A state-of-the-art emergency room setup is here at the Helen DeVos Children's Hospital. We're here with the medical director, Dr. Matthew Denenberg, and tell us about what makes this so unique.
You know, I think if you just walk around, look around, everything is designed for children. It's designed to make them comfortable in an uncomfortable environment. It's designed with the equipment, supplies, and personnel to treat sick kids with any kind of problem. I think that it's clearly a design for the care of kids.
And from the very beginning, when a patient would arrive, whether with their parents or with an ambulance, how is even the reception different here at the Helen DeVos Children's Hospital?
When a parent comes in through the main entrance with their child in a car, we take the child and the parents straight back into the emergency department into a private room where staff is waiting to take care of them. We have valet take their car and park it, so parents don't have to worry about how they're going to get in. They just come in and their child's ready to be treated. And if they come in by ambulance, those are typically the sicker kids, and those kids will be brought right back through the ambulance doors into the main part of the emergency department and brought into one of these two main critical care areas.
And as an emergency doctor, how is the equipment different for treating kids than for treating adults?
So some of the kit actually is designed for smaller patients, and some of the equipment is designed for all patients, and I think that that's the difference, and we're able to adjust the alarms and the settings and the systems for different physiology, different size and age of children.
And that goes along with not just the equipment, but the training and expertise of the people who are on staff here.
The personnel are a team of people that are trained and competent and want to take care of kids. I mean, that's almost as important as the competencies. You want to take care of kids, and everybody in this building is going to want to take care of the kids.
And the philanthropic part of this, where you've had so many people step up with such wonderful donations, how has that helped to equip this?
Without the philanthropy, we wouldn't have been able to build this building. I mean, the philanthropy of the community of Grand Rapids has been amazing, and it allows us to do things like Safe Kids, the Child Protection Center. It allows us to take care of kids that otherwise wouldn't have anywhere else to go or have any care. They don't have insurance, and so that's allowed for this building and for this team.
And of course, sometimes those kids are in need of surgery. We have specially trained experts here to provide those services as well. Let's check it out. We're here in one of the specially designed operating rooms with the president of the Helen DeVos Children's Hospital, Dr. Bob Connors. You're also a pediatric surgeon. Tell us what makes this room so unique.
Well, you know, we do about 10,000 children's operations at the Children's Hospital every year, so we need a special place for kids. And that's children from way bigger than either of us to weighing only about a pound or two. So you need all the best technology to keep them safe. We keep doing more and more sophisticated operations, heart surgery, abdominal surgery, all kinds of surgery here. So what you see around you is the result of that.
And the layout and the design of this room, you had a critical part of that because of your history, 2 decades of performing these kinds of surgeries.
Being a surgeon has a certain advantage to that. Yes, you should be good at designing operating rooms, and I think that these operating rooms are special places for these kids. You can see some of the technology around you here. We're increasingly doing a lot more of these operations using scopes, minimal kinds of invasive sorts of things. So you're literally doing the operation with those TV monitors, those monitors being your eyes. The anesthesia machine delivers the tiniest little bits of breathing to tiny babies, or enough for a big, large teenager. So they're very sophisticated, and this is a wonderful, wonderful space. You can see they're also very large. And you think, well, why do you need such a big room for a little tiny baby? Because you need equipment. You need microscopes, you need laparoscopes, you need other kinds of stuff in these rooms now. So that's why they've gotten big, they've gotten very technological and very expensive, frankly.
And you need people in here, and you have a team of people who support what goes on in this wonderful room.
Well, you've probably heard me say before, you can have a room like this, and it's empty now except for us. Not much good to anybody, is it? But we have a great team of people here. And I think it's one of the really unique things about Helen DeVos Children's Hospital is the team of specialists that we have to do surgery. So we have specialized anesthesia people that have done extra training to keep kids safe when they're asleep. We have nurses that just do kids all day, every day, so they understand the differences, what makes kids frightened in the operating room, how to comfort them, how to get them through a stressful experience. And you have an array of surgeons here that are really unmatched anywhere else in this part of the state to do all kinds of sophisticated surgery here. So you're absolutely right. Technicians, nurses, the whole team of people. And that's what I think a lot of people just don't realize, how lucky we are to have that team here and how many communities don't have such a team.
That's right, the team, the technology, the people, life-saving miracles that happen every day here at the new Helen DeVos Children's Hospital. You know, it really is incredible. You know, and the amazing part of it, they have to care from the teeniest, tiniest little premature infant to an adult-sized adolescent. And one of the interesting things about the emergency room setup is every single one of those 20 emergency rooms, each one is equipped with nitrous oxide.
Laughing gas?
Laughing gas, exactly.
Commonly known as, I should say.
Exactly, like you would get at the dentist.
Right.
What that does is it takes the edge off without interfering with the ability to use other forms of anesthesia. Really works to, you know, just help make the patients less anxious and help to give them a little bit of comfort for those procedures that they may have to do immediately, especially for those patients that are brought in either by Aeromed or by the ambulances.
I tell you, just so far, I mean, this is a beautiful place, and I say that because it's wonderful to know that it's there. Mm-hmm. It's the place that you never want to go to if something happens or something traumatic to someone that you love or someone that you know. But my goodness, to be able to see this really makes me feel like the people that I know that will go there, if my family member one day, is going to be in really good hands.
That's right. The lives that will be saved there, it's incredible. To think it all opens tomorrow. Incredible. We'll be right back.